Hi, this is CF Liu. Now, myself and the team got asked a lot like, is there any medical card in Malaysia that actually covers you internationally? Now, it's not common, right? So, there are very few selected ones that we will actually aware of and recommend. So, this is the lesson for that. Now, if you haven't subscribed to CF Liu channel, just click on subscribe, on your lower right hand side. Just click on the red button is popping up. Click on the notification bell if you haven't you want to be notified when we publish useful lessons like this on our channel. And also, by the end of this lesson, just you have any question, just ask, type in your comment section below. And if you have enjoyed, you find this useful, click on like. That will actually help very much in this channel. Now, giving us a like doesn't really cost you any money, so we'll really appreciate that. Now, that being said, let's get back to here. Medical coverage in US dollar, right? US dollar. Now, if you really want to seek treatment, you want to have that option to actually seek treatment outside of Malaysia, right? And some more, it covers you in US dollar, a medical coverage in US dollar. That is why you want to actually watch this until the end. Now, this medical card, there are a few ones that that does not, the first one I'm going to cover, it does not impose any limitation on which country that you will be going for treatment. It could be Singapore, could be US, could be Canada. No matter where is the country, they will cover you, right? And it's by a Malaysian insurer. Now, basic needs, that I have no need to tell you that timely medical care locally should, it's very important, right? Medical card, even you have a local or international medical card, is because you fall ill or meet with an accident which does leads to a hospitalization. It's very important for you. It's not about public hospital no good. It's just about sometimes because there's a long waiting queue. Now, if you are aware that hospital long queue. Now, if you have experienced that in Malaysia, wait until you go to Hong Kong, right? And also come to know this from a Hong Kong kind of mind. What happened is that public hospital in Hong Kong has the best kind of service facility, right? In the world, one of the best medical care in Hong Kong. And then best is because it's also affordable. Like, you need to just pay like, I don't know, like less than 200 US dollar or Hong Kong dollar just to get a world-class treatment. The problem is it is really, you have to, there's a long waiting queue, especially waiting for transplant or certain surgery and all that. I think worse, longer queue, world-class service, world-class kind of facility, but longer queue than Malaysian hospital. Imagine if you have a life-threatening illness or medical condition, you cannot wait. But that's the situation in Hong Kong, right? Which is why it's very liberalized. Whether you are poor, whether you are rich, you go to a government public hospital, you have to wait. And you virtually, it's heavily subsidized by the government. Now, you don't have to be in Hong Kong to actually understand it, because I've recently watched, a Hong Kong drama which is really, really good. If you know this, is called Big White Duel, I think. I hope I got that. I don't really follow a lot of Hong Kong drama, but this Hong Kong drama I will actually recommend it. It's really, really good, right? It talks about it's a fictional drama about Hong Kong health reform, but still it's very good perspective to actually get into glimpse into this what is happening when the health sector in Hong Kong. So Big White Duel, you can just check out the links below that, or show it over here. Really good Hong Kong drama, about 25 episodes and all that. The superstar, the TVB stars aside, it's really a really good, very good storyline. Now, I digress. Let's come back to here. Now, what if you find that some of these very critical illness, that you found that the most suitable and the safest, most advanced treatment for your medical condition is not located in Malaysia, maybe in Singapore. So, do you have access to the hospital? How much do you know about the treatment in Singapore or whatnot? How much it costs? Are you worried that you undergo treatment in a country you're not familiar with, right? There's a lot of things, you don't want this kind of actually bother you. And what's the next step? Now, medical card, when a kind of international coverage, a medical card offered by Malaysian insurer offers you international coverage in US dollar. They don't cover you for everything under the sun, especially if, let's say, you just have a cyst, right, on your hand. There's no reason for you to go there, right, and do that, because Malaysia you can do that. Why you want to go overseas? But we're talking about more critical kind of illness or condition like cancer, right? Now, this is the definition of cancer, right? What is not covered, what is covered. It exactly follows critical illness coverage. And the other thing is these few conditions, cancer, coronary artery bypass, again, one very critical condition. It covers for heart valve surgery, all right? It covers for live donor for organ transplant and also bone marrow transplant, right? So this is the definition. You can pause it if you really want to look at the definition, but this is what I copy and paste for this and intracranial and specific spinal cord surgery. So these are the normal thing, the usual condition which justify for overseas treatment, right? It could be safer, more advanced, and all that. So normal Malaysian medical card does not cover that. Okay, does not cover that. You could be referred to say Singapore, but it only covers you for reimburse you for a Malaysian medical rate. Now, what is the Malaysian medical rate? Now, it follows the 13th schedule, of a Private Healthcare Act. If you missed that video where I talk about this, you just click on there should be something popping up on the upper right hand corner. Just click on that video after this video ends to know what is the cost of medical procedure in Malaysia. Now, that being said, daily room and board or ICU, the medical card actually, at least for this product, actually covers you for as charged. So there's no limitation on it. You can stay in your executive suite. But they don't impose limit. But there's a limit in terms of the annual limit. Annually, you can use up to, there's a two plan, right? Plan 1, you can up to like $1 million US. That's a lot. If you can use that up in a year, I would rather die. Plan 2, 2 million annual limit. Lifetime limit, there is a 2 million or a 4 million lifetime limit. And as you know, it's cashless, right? This is a special medical card, right? Normal medical card, you being referred to overseas in Malaysia, undergo treatment, not only reimburse you only for Malaysian medically necessary rate, only also it's not cashless because you have to pay first overseas and then reimburse back from the insurer. Insurer normally don't pay you the full amount after currency conversion. This pays what is in Malaysia, but this actually remove that kind of barrier, right? Because it's a cashless kind of thing. Now, how this normally works is that they will have to get a second opinion if it says that you justify, safer for you to go overseas for treatment. Again, transportation accommodation is arranged and is also covered. Normally, Malaysian medical card don't cover you for any, during the transportation accommodation, even if you refer to the hospital overseas in Malaysia, let's say in Singapore, but this actually covers you. Also covers for another one, what we call as a companion, right? The patient and the companion. So they allocate that for that. If it's an outpatient treatment, it will be in the hotel. With plan 1, they say 3 or 4 star hotel. With plan 2, of course, they say 5-star hotel, right? Or, you stay in a hospital. Plan 1, economic class is kind of transportation. With by plan 2, it's what you call business class, an upgraded transfer in limousine. Whoa, I mean, like, sounds good, right? When you are traveling, but when you are sick, you couldn't actually really care less about whether it's in business class and all that, right? Just my opinion, right? So if you disagree, just click on like anyway, give it a like, and subscribe if you haven't already. Now, this is the first option. Of course, the second option also offered by another Malaysian insurer is that they cover you. Yes, they allow you to go for treatment in Singapore, Hong Kong, China. So very limited in terms of the country, right? Singapore, Hong Kong, or China. But they only cover you not in USD, not as high as a limit. They only cover you for 250,000 in Ringgit Malaysia, either on a yearly basis or on a per condition, medical condition basis with a 2.5 million lifetime limit. So again, this is like a lower tier version offered by another Malaysian insurer. Of course, you want to know, like, how much it costs, what is the details, how many years it will cover me, and all that, which insurer it is. So just you can actually comment below, and we'll direct you to the right way, because again, as an independent advisor, I don't want to really promote certain insurance product, because we are independent. It depends on your needs and all that, right? Which is why it's all about educational sharing and all that. But again, we absolutely can do this for you. Now, that being said, if you haven't subscribed, subscribe to CF Liu channel, click like and notification bell, comments below, you know, if you want to know more, and myself or my team will actually get back to you. This is CF Liu. Hope this lesson has been useful, and I'll see you in another lesson.